Hello, assalamu alaikum. My name is Manal Moussawel. I'm a naturopathic doctor, and this video is recording of my practical exam. First of all, I'd like to record my station. Here we have some gloves, 2 pumps in case one of them is not working, some disinfected wipes, a sharp bin, some plastic cups, 1 extra one, olive oil, coconut oil, size 15 blade. I have a few of them. Alcohol swabs, hand sanitizer to sanitize my hands in between, cotton buds, and tissue to clean the area. We have the rubbish bin here, the massage bed, 2 towels for draping. Walaikum salam. Come in, take a seat. How was your day today?
Yes, good.
That's good. So we just have some questions to ask you before we start our Hijama session. Before we do the Hijama sessions, there's obviously a medical history form. Have you eaten any food in the last 2 hours?
No.
No. And are you on any medications?
No.
Okay, great. Are you diabetic?
No.
That's good. Are you anemic?
No.
No. Okay, and of course you're not pregnant. Do you have any seizure disorders, epilepsy, or anything like that? Okay, awesome. And do you have any allergies to any oils, olive oil, coconut oil? Okay, great. So what I'll get you to do, there's just some bookkeeping information here to put on our file, on our system. So I get you to fill out your personal details here, and this is the medical history. Just tick the boxes if there's anything. And just at the end of the form, so after you've filled out the information, this is the pain chart for you to mark any points that you want us to focus on. And just towards the end here is your signature, please. After you've read the contraindications, the precautions, and just the terms and conditions, and this is the consent that we'd like you to sign, inshallah. Okay. Once you've done that, I'll talk you through the next step of the Hijama session. So this was the medical history form that was used. It was printed out from the Hijama Nation modules. And signature at the bottom. So just washing our hands before we start the treatment. Make sure we put some soap, wash thoroughly. Making sure that you've done a ghusl before the Hijama session.
Yeah.
And what I want you to do as I'm doing the Hijama, the wet cupping, I'd like you to read some Quran. So I'd like you to read the 3 Quls, Qul Huwallahu Ahad, Qul A'udhu Birabbil Nas, and Qul A'udhu Birabbil Falaq. And you can also read Ayat al-Kursi. And inshallah I'll be saying some dua as well. We could say the dua, Allahumma ashfi anta shafi la shifa'an illa shifa'uka shifa'an la yughadiru bihi saqman, or bismillah alladhi la yadurru ma ismihi shay' fil ardi wa la fis sama'i wa huwa as-sami'ul alim. So we can now get started with the moving cupping. So now we can get started with the moving cupping. So I'll put the first cup, I'm using a large cup, I'll put that on C7 to start off with, and I'll do 1 pump, Is that okay?
Yeah.
And do the next pump. Is that okay?
Yeah.
Okay, so I think 2 pumps is enough. We can see the muscles rising, and we can see if we can slide the cup, if it's easy enough for us to slide or not. And we can just go in vertical and horizontal movements. If we feel that the cups are not sliding and gliding enough or easily enough, we can add some oil to make it easier for us. So just up and down movement, across, down, and then we can go to the other side, across, down. Just make sure we cover the entire area up the back. We can go all the way down as well, but I'll obviously be focusing on the upper. Okay, and then we can also go in circular movement. Once we see the area red enough, that's when we know that there is blood circulating into the muscles. Is that okay? You feeling okay?
Yeah.
Okay, just some circular motions there. Okay, so once we feel that we've released enough muscles, it can take up to maybe 5 minutes, 10 minutes. It depends on how long the session is for. We can pretty much take the cups off when we feel that there's enough blood flow to the area and the muscles are relaxed. After we take the cups off, we make sure to wipe the oil off the back before we start our wet cupping. We sanitize we wash our hands. I'm going to sanitize my hands now, so I don't keep going to the sink. So sanitize our hands. And of course, we've got to make sure we wear our gloves for the wet cupping. And I will be removing the oil with a paper towel. Just removing. Make sure there's no oil on the back area. And just throw that in the rubbish. And just sanitize our hands again after we've done that. Okay. Put our gloves on. Make sure the gloves are fitted enough. You don't want loose gloves. So we'll be putting the cups for 3 minutes on point 1, 2, and 3. So I'll start off with point 1. I'll use a smaller cup, C7. Is that okay, that many pumps?
That's alright.
Okay, I'll just go half a pump more, just to make sure it's secure. So this point is pretty much under the scapular area, around the rhomboid muscles. 1, 2. Make sure it's not too tight. Is that okay for you, that many pumps?
Yeah, it's alright.
And maybe just half one. Okay, so we leave that for 3 minutes. So this is the 15 blade razor. I'll just open it a little bit because we'll be putting it back in the packet. Okay. So I'll leave the packet here so that I can put it back in there. Okay, so it's time to sanitize the area where we'll be cutting, doing the little incisions with alcohol swabs. We can remove all the cups and sanitize all of them at the same time, or we can remove it one at a time. I will be removing all of them so that they're not in my way. And the way we sanitize the cupping area, or the area that will be cupped, is in a circular motion starting from the center, going around just like this. Okay, so we'll do that for all three of them. I like to use an alcohol swab for each one so that we don't contaminate the other cups. So once I've done this, I'll throw this one in the bin and then use another alcohol swab. So we'll be doing the incision starting from right to left, many incisions as we can in the area, and very superficial cuts. In this time, I'll be saying Bismillah, and I'll be getting the client to read his Quran at the same time, and I'll make dua as well. Bismillah. Bismillah. Is that okay? How are you feeling?
Yeah, good.
So I won't be using the tip of the blade, just the curved area. Little incisions. So filling up the area. Again here as well. How are you doing?
Yeah, that's all right.
So just making sure that the client's doing okay, reassuring him. Sometimes when there is a little bit of hair, we just have to cut in between. Okay, and just a reminder that we have sanitized all of the areas before we're doing the incisions. Are you doing okay?
Yes, all right.
Okay. We just make sure we put the razor back in the packet just in case we need to use it again. Sometimes we feel that we haven't done enough incisions. We can go back and do some more incisions. So put that back in there. And same process, just make sure that the pumps are not too much. Keep asking the client.
Yes, good.
Okay. 1, 2, 3. I like to remember how many pumps I did when I first put them on, so that way I can just do the same amount of pumps again. 1, 2, and half of 1. As we can see, the blood's coming out very nicely here. So just make sure you keep checking, or I keep checking, that the cups are tight enough. Sometimes the muscles in the skin become loose and the muscles relax, so we just have to make sure that the cups do not become loose and the pressure is still strong enough for the blood to come out. So now it's time to release the pressure and remove the blood and clean the area. So I'll be using tissue, soft tissue. We can use as many tissues as we feel we need. It just depends on how much blood's come out. I like to use about 3 in this position like this, around the cup, and just release. A little bit of airing, sometimes that helps with the clotting of the blood. and scoop, scoop. Put the tissue in the cup and continue the same process. Scoop and move in. Scoop and in the bin. So the way we need to clean up the area after we've done the incisions is different to when we first put the cups on. This time we'll be using the alcohol swabs in a different direction, starting from the top, going downwards. Top, down, top, down, top, down. Again, I use different alcohol swabs for each area. Okay, so the process goes like this, from head to toe, head to toe, head to toe. And one more. Using some cotton buds, dabbing some olive oil on each area. I'll use different cotton buds for each area. Okay. And then I'll also seal it with some coconut oil. At this point, I can use the same cotton bud. Okay. How are you doing?
Alright, okay, you're good.
Okay, so what I would tell the client after we finish the procedure or the process of the hijama wet cupping, just to get him to stay in that position for a few minutes before he gets up, just in case he feels lightheaded or feels any changes in his body. So after he feels he's ready to get up, take the towels off him. We can just let him know that we're all done and he can get dressed so that we can explain the aftercare for him. And in this time, I'll be removing my gloves and hand sanitizing or washing my hands. And I can also clean up the area while he gets dressed, or we can do that after the client has left. There's just a few points I'd like to explain about the aftercare of hijama. So what I'd like you to do is to have some dates and have some water. So this is some dates for you to have, and a bottle of water. And just a few points for you to keep in mind, just to make sure you apply oil on the incisions. Every time you feel that they're getting itchy, just apply some oil on them. Get someone to apply some oil, coconut oil, olive oil, any oil is fine. Coconut oil is always the best option every few hours. So today we'd like you to eat a balanced diet. So try to eat healthy fruits and vegetables. Make sure you're drinking lots of water. After the hijama session, you will sometimes feel tired, so make sure you rest. Avoid eating dairy, meat. Try to treat this like a detox, okay? It's better off for you not to have a shower in the next 24 hours. If you really need to, avoid using any shampoo products or soap. And we don't want you to do any swimming, nothing that has chlorine in it, or even soaking in a bathtub, okay? So one more point as well, no sexual intercourse within the next 24 hours. And if you do feel that you have any mood changes, that is very normal, okay? There are a lot of things that could change. You could have some sort of a heating crisis or bowel changes. Any of these things could happen. If you feel that there's anything concerning you, just please contact me, give me a call, send me a message. Anything that you feel is unusual, don't hesitate to ask and give me a call. I'm going to book you in for your next hijama session after 3 weeks. Okay, so we will be doing the hijama session 3 times in a row. This is part of the detox process, okay? So you just let me know when is the best time and the best availability for you.
Alright, this is the payment. Thank you very much.
Thank you so much. Thank you. See you next time.
Thank you. Bye bye.
It's time to clean up the area. I'll be putting some gloves on to do this. Okay. These are the dirty towels. They go into the basket here for me. Okay. This is a disposable sheet. Okay. And I'll be using disinfectant wipes to clean up the area. So I start off with cleaning up the face head of the massage bed, just like this. Make sure it's all clean. Put that in the rubbish. And we just make sure that we're cleaning everything. All the pumps, both of them, just in case I've used one and didn't realize. The sharp razor in the sharp bin. And just making sure that we disinfect the entire area. Hand sanitizer. All of this goes into the bin. We remove the gown. This also goes into the wash. Just like this. And remove the gloves into the rubbish bin. And make sure we either hand sanitize our hands or wash them. Thank you so much.